Ankle replacements are becoming more common. One reason for that is because the designs are improving. Back in the 1970s, there was a real enthusiasm to start doing ankle replacements because hip and knee replacements were doing so well. Then as time went on, we found that those designs failed, and so in about the mid to late 80s, some new designs came out, and those designs are becoming much more successful. So we're starting to get some good 10 to 15 year follow-up on these replacements, and they're doing much better. The ideal candidate that we're looking for an ankle replacement is one that ideally would be above 60. They'd have good alignment and good blood supply, good skin and tissue in that area, and of course they have just bone-on-bone arthritis, and so those are certainly our best candidates. And the latest design that was just approved here by the FDA has been what's called the STAR ankle replacement. And it's one that I have sitting here. It's a little bit different with the other ones being just metal and plastic and being fixed. This one has a plastic component in the middle that is what's called mobile. It moves. And the concept behind that is that it's going to take some stress off the other metal components, be less likely for the plastic to wear out, which can be a problem with hip and knee replacements, and take some pressure off the metal components so that they don't loosen, which can also be sometimes a problem. So we have a lot of enthusiasm about this. As I said, this is the latest one I've been doing. There's about 4 different ones out there that are FDA approved. I've done all of them, and for the most part this is the one I'm doing now over the last year when they became FDA approved. So I think if a patient has end-stage arthritis, that this is becoming a very realistic and good option for them. The other main option other than ankle replacements for end-stage arthritis is an ankle fusion. An ankle fusion is when you take 2 bones and you make them into one bone, essentially fusing them together. You definitely lose some motion with an ankle fusion. It's not like a knee fusion, which you lose all your motion, because there's joints around the ankle which are still mobile, and so with an ankle fusion you'll still have some mobility.